Introducing Cingal, a powerful single injection treatment for the management of osteoarthritis pain. Cingal is a combination viscosupplement that combines the long-lasting benefits of a cross-linked hyaluronic acid with a well-established and fast-acting steroid.
I'm Femi Ayeni. I'm an orthopedic surgeon. I'm an associate professor of orthopedic surgery as well. I have published several books and over 300 papers on hip conditions and hip injuries affecting the young adult and middle-aged adult. I'm also the medical director of several professional teams in the local region. So typically with the patient, image guidance is helpful, although landmarks are possible. For precision, image guidance helps, typically an ultrasound probe. The patient lies in a supine position on their back and the hemipelvis is exposed. So in order to deliver the hip using anatomical landmarks and guidance, first it's good to mark out your anterior superior iliac spine and draw a line from that all the way down to the mid-thigh. That demarcates where the neurovascular structures are that you'd like to avoid. Then it'll be good to go lateral to the side of the hip and mark out the greater trochanter, and that essentially will be the lighthouse into the hip joint. And once you have the anterior superior iliac spine marked medially and your lateral border as the greater trochanter, the proximal border or the top of your border will be the inguinal ligament. And so with the borders of the anterior superior iliac spine, greater trochanter, inguinal ligament, and mid-thigh, you typically have that rectangle of safety that you can inject through. We prep from the inguinal ligament using an alcohol swab to the mid-thigh. That way you have a sterile area for your injection. And then somewhere around the halfway point along the course of the inguinal ligament, you apply some gel and your ultrasound probe. We get the probe for the ultrasound, and we're going to apply this probe onto your hip now to identify the joint. Local anesthetic is important to ensure this is a comfortable procedure because this is a deeper injection. So raising a 5mm skin wheel at your injection site is important, and then aiming using the ultrasound to inject your needle tract just short of the capsule. And by having that, the spinal needle then follows that same tract down what has been anesthetized, allowing this to be a very comfortable injection. And then with a spinal needle of 20 gauge, you inject Cingal. And then you deliver your needle under guidance at a 45-degree angle right to the joint capsule, visualizing it on the probe. Once you have the spinal needle down to the capsule and you pierce it, you withdraw the insert, tighten the syringe of the Cingal product, and inject it, and typically you get a good distension of the capsule and intra-articular fill. Patients are also told that in certain cases you may expect some local skin irritation such as mild redness or swelling, but no systemic symptoms such as no fevers, no chills, no rigors, which is important. And that small area of redness can be anticipated in some patients but subsides without incident.